The Trump-Pence administration say that they want to end HIV and AIDS by 2030.
Trump is set to deliver his speech before Congress, will also outline a strategy for ending HIV transmissions in the U.S. by 2030.
That's a noble goal. Here's some of the big things it'll take. Number one, access to health care free from discrimination. More people would need to get health care and coverage, especially the most at-risk populations, LGBTQ, Black, and Latinx communities, especially those living at the intersection of these identities. Instead, the Trump-Pence administration has fought to repeal the Affordable Care Act that would strip away coverage and non-discrimination protections.
The Health and Human Services Department created a new division called the Conscience and Religious Freedom Division.
Controversial move will see two groups getting hit the hardest: women in need of abortions and people who identify as LGBTQ.
It will allow states to go ahead with the sale of cheaper and skimpier health insurance plans. But some of these do not have to cover pre-existing conditions.
And that could make coverage a lot worse for people all over the country.
Number two, expanding Medicaid across the nation. Low-income individuals would need access to health care. Instead, the Trump-Pence administration has tried to gut the Medicaid program. And number three, ending stigmas and ensuring PrEP access. More people need to have access to PrEP, the only preventive HIV medication, and to routine follow-up care, and will end the stigma surrounding HIV, period. Instead, Mike Pence has one of the worst records on HIV of today's elected leaders, and we still have far too many barriers to PrEP access. I mean, remember this?
If the legislature sent me a broad-based needle exchange bill, I would veto it.
Which led to...
Austin has a population of only 4,300 people, but 150 from in and around town have become HIV positive in just the last several months.
Ending HIV and AIDS is possible, but it will require real work, commitment, and funding. And it will require this administration to expand healthcare access, not restrict it.